after delivery. So whatever happened to the patient in these 40 days, yeah, especially in obstetric or for the female, but not in a medical. So you have to refer her to the team that is specialized for her. The gynecology, it involves the treatment or treating women who are not pregnant. It's involved from puberty till postmenopausal. It's mainly the reproductive age of the female. Also, the postmenopausal period, you can deal with the patient if she had postmenopausal symptoms. So you are dealing with a female in all over her age, except for the childhood. You are treating her, dealing with her condition, and seeing what problem that she has. So what are the pros and cons for obstetric and gynecology? Why I applied for obstetric and gynecology and why I don't apply for that? It's one of the pros, it's combined between medical and surgical specialty. So if you don't like pure medical or pure surgical, you have some of these and some of these, you can apply for obstetric and gynecology. Take in mind that it's a general branch. So it's like a medicine, it's like a general surgery, it's like a pediatric. There is subspecialty, and you are dealing with a broad spectrum of patient, broad spectrum of conditions. But again, in obstetric and gynecology, all the conditions, about 20, 25 maximum condition that you can deal with it. So you can combine between the medical and surgical specialty. And if you want that, you can go for obstetric and gynecology. The beautiful thing is that you are sharing the journey with the mom till getting her baby. So you are dealing with the female or with the mom from the beginning of the pregnancy till having the last day of her pregnancy, and hoping that you have an which is called happy ending. But it's not always a happy. Sometimes it's, unfortunately, it's not happy for her, the mother, not happy for you. Many complications can arise. Baby can die, baby can deliver unhealthy, mother can die, mother can be unhealthy, can go to ICU. So it's most of the time it's happy, but you have to keep in mind that sometimes you can face a problem, face a complication that make your day so bad. So no long rounds. One of the things that make me choose OBGYN, I had the long round. So like in medicine, you are taking round for 4, 5, 6 hours. Sometimes you are doing, say, sitting with a patient, say, and doing rounds, analyze the patient too much. So you don't have this in OBGYN. So it's, as I told you, it's only about 20, 25 condition. Most of the time it's straightforward. You can deal with the patient. So no long round for that. It's only patient specialty. So you have to keep in mind, once you choose the obstetric and gynecology, you will not see a male patient after that. So you are only dealing with a female patient and with a female condition. So if you can handle this, you can handle that. You are dealing only with the female, the hormone disturbance, and sometimes the patient is not well. Sometimes hormone is up, patient is happy, hormone is down, patient is down. So you have to know how to deal with the female. One of the cons, the specialty with the higher medico-legal issue. This is unfortunately the most cons that no one happy with it. Yes, of course, we have too much high medico-legal issue, but as much as you can take care of your patient, you are going with the guidelines, you are not just think in your mind and do wrong things, you can go ahead. You don't have to fear from the medico-legal issue. As much as you call your senior, this is will protect you. So also keep in mind that in pregnancy, in obstetric mainly, you are dealing with two, not only one. You are dealing with the mother and the fetus. So these two, you have to reach till the end of the story with a good health for the mother and for the baby. So those two, you have to follow them up, and you can deal with two patients at the same time. So Saudi board, actually, before talking about Saudi board, we have Saudi board, we have Arabian board, we have Jordanian board, and also you can go outside and have the obstetric outside. Mainly about Saudi board, here in Saudi Arabia, it's a 5 years program. Once you finish the internship, you are applying for the board. It's a 5 years program. It's divided to 3 years senior and 3 years junior and 2 years of seniority. You have to have an exams. In this board or in OBGYN board, you have the till last year. Unfortunately, they are changing the rules and changing the exams almost every year or every 2 years. But there is a fixed exam, which is part 1 and part 2, written and OSCE. So part 1 exam, you cannot pass R3 and reach R4, the senior level, till you have to pass the part 1 exam. You can go for part 1 in R1, you can go for part 1 in R2, you can go for part 1 in R3. But you have to pass it. If you didn't pass, you cannot reach R4. So you will be still in R3 till you pass the part 1 exam. Then about the end of year exams, it was every year exam. We were having exam at the end of the year. After that, they changed it to 4 exams per year. Last year, it was about 2 exams per year, one in the mid of the year and one at the end. This year, I think they change it and they cancel about, I think, all the, but they refer the evaluation for the center. So the center can make for an exam, either every 3 months, every 6 months. I don't know. It depends about the center you are going with. But at the end, you have to have an exam. And also they add OSCE every year. It's done in the center, not on في الهيئة. On calls, for sure, you have an on call. Like other specialty, it's not a home on call. And you have to be in the hospital, either to cover a labor room or to cover awards or ER. There is rotations in the 5 years program. You have about let's talk about 10 or 11 rotations about the different subspecialty in the OB/GYN, also for an ultrasound, ICU, NICU. All of these you have to run overthrow in the 5 years. Research, you cannot finish your program without promoting or providing a research for the counselor. So they promote you to finish part 2. Part 2 exam, it's divided to an written and OSCE. If you pass the written, you can apply for the OSCE. If you didn't pass the written, you cannot apply for the OSCE. If you pass one, if you pass only the written, and then you apply for the OSCE and you didn't pass, then you can classify as a specialist or you can classify as a registrar. But if you pass both, you can classify as senior registrar. If you didn't pass both of the exam, either written, so you didn't pass the written, so you cannot apply for the OSCE. There is a prometric exam, you can have it. If you pass that prometric exam, you can classify as a specialist or the registrar only. But you have to pass then part 2, so you can complete and to reach a consultant and you can apply for fellowship. To reaching a consultant, you have to finish part 2 exam, written and OSCE, and then either to practice for 3 years and then you can apply for consultant classification, or you can go for a fellowship and then after that you can classify as your fellowship. So what are fellowships or subspecialties that you can apply after finishing the board of obstetric and gynecology? First, the reproductive endocrinology and infertility, or as everybody says, an IVF. It's the subspecialty that concerning about a female reproductive endocrinology and infertility. So it's not only infertility, so not only the infertile patient, the PCO patient, the disturbed period patient, the patient with with precocious puberty, the patient with delayed puberty. All of these patients are going for these subspecialties, the reproductive endocrinology and infertility. So they are not for the general. Unfortunately, till now, this is in the community, it's not known. They are going for a general obstetric and gynecology. They are spending a lot of time, and at the end, they are going for the infertility doctor. And sometimes it's unfortunately too late. You cannot get pregnant while you are old age, or if you have a problem and you are only going for it's the specialty that supposed for the oncology, the one who's taking care of cancer in vagina, cervix, uterus, and ovary. It's tough fellowship. It's surgical, mainly surgical. You have to deal with the patient with different stages of cancer, but you are dealing with it as a surgeon, not as a medical. So if the patient is operable, you can operate her and then refer her to the medical oncology. But if she's not operable, so you directly refer her to the medical oncology. So it's not your patient. Maternal fetal medicine, this subspecialty, it's about taking care of mother and fetus at the same time. So what does that mean? If the mother is having medical diseases, hyperthyroidism, hypothyroidism, diabetic, if she had any hematological diseases, if the baby found on the ultrasound, the fetus that it's have congenital anomaly, all of these, it's undergoing the maternal fetal medicine. So any problem or any patient with medical condition, she had to follow with maternal fetal medicine. Then the female pelvic medicine, reconstructive surgery, or as known as urogynecology. They are concerning about the pelvic floor problem and like prolapses, uterine incontinence, urinary incontinence. These patients, these female, they can deal with this doctor, the urogynecology. These 4 subspecialty are available in Saudi Arabia. You can apply for them. All of them are 3 years subspecialty. It ends with an exam also. Like in infertility and gyne-onc, we have an exam every year, OSCE and written exam. And at the end, we have final exam and OSCE exam also. Fetal-maternal and female pelvic medicine, they don't have every year written exam, but they have every year OSCE. And at the end, they have final written and final OSCE exam. What else we have? We have minimal invasive surgery and robotic. Minimal invasive surgery was one of the branch going under the reproductive endocrinology and infertility, but nowadays it's separate to a different subspecialty called minimal invasive surgery, or MIS, and robotic. These mainly going with laparoscope, hysteroscope, and these surgeries. It's deal with everything. You can go with reproductive endocrinology and also doing a minimal invasive surgery. So you are you can go for laparoscopy also, no problem. Oncology, yes, you can do your procedure for oncology with a laparoscope or robotic, but you have to take this fellowship. But as you finish the reproductive endocrinology and infertility, you are you can apply, you can do minimal invasive surgery. So no one can bother you, or no one can say no, you don't have the privilege. Also, we have genetic and pediatric and adolescent gynecology. This subspecialty, it's mainly for the pediatric and adolescent gynecology. Their problem from the age of 8 till the age of almost 12 or 13. Unfortunately, these 2 subspecialty, they are not available in Saudi Arabia. They are available outside. You can go for it. Also, labor ward management. This one of the fellowship that are not available in Saudi Arabia. You can do it outside and came. Labor ward management, till now, I haven't met any Saudi doctor have this fellowship. The minimal invasive surgery, yes, there is a lot of them. And also the genetic and pediatric, there is almost 3 or 4 in Saudi Arabia. So about lifestyle, I didn't write any slides. Lifestyle, it's like you are in a surgical branch. So you have to keep in mind that this surgical branch, it's in residency lifestyle, it's almost the same. You are in, I mean about the general branches, not the subspecialty. Like if you apply for ophthalmology, ENT, they have home on calls. They don't have too much stress in the residency program. But like in general surgery, neurosurgery, you have to be in the hospital. You have to have much on calls. There is much stress. In OB, general surgery, the tough specialty that your lifestyle is one. You have morning round, you have OPDs, you have surgeries, you have on calls. On calls is different about the center. Like some centers, they are having 24-hour on call. Some center, they are having 16 hours on call. So it's different from center to center. But at the end, it's one surgical lifestyle at the residency program. You can handle it. Yes, you can handle if you can manage your life for that. You can handle the stress. It's a stressful life. It's not an easy. But also it depends about the center you are working on. Like if you are working in a governmental hospital, which kind of governmental hospital? Is it a big center or a small center? Big center, you have too much flow and too much patient, too much on calls. But also you have too much patient, you have too much cases, you can learn more. As much as you see patient, as much you deal with patient, as much you get learned. Like if you talk in universities, hospitals, they have less loaded, less patient, but you have more academic education, not like a governmental hospital. The governmental hospital, they want to turn over quickly. They want the patient to go quick. The consultant, they have too much to do. So there is no time for educational study too much, but there is in the board, you have 1 day, half day academic day, and there is teaching, there is everything. Always I told the resident, if you want to learn something, you will learn it. And if you don't want, no one will let you learn. So in residency, no one will feed you. So you have to go and look for the information. You have to go and look for the patient. You have to dig yourself in the patient, in the OR. You have to see much. You have to learn much. Because if you don't, no one will tell you, come, I will let you learn. Or no one will call you and come to us and join us our OR. No, this you will not find it in residency. In university, as I said, there is more academic doctor. They're keen about learning, teaching, and doing lectures. So these major difference. After finishing the board, you always think about and telling the resident or telling anyone who has asked me, how's your lifestyle as a consultant? If you are a consultant, you can choose your lifestyle. Like if you are working in a governmental hospital, you have a morning duty, you have about 2, 3, 4 maximum on calls per month. Rather than that, you are free. You are finishing your morning duty, then you go home. You don't have anything except if you are on call. And also as a consultant in the governmental hospital, you are a home on call. There is a specialist, there is a resident in the hospital they are covering. If they have any complication, they can call you. Of course, they will call you about maybe every single admission, but you don't have to be in the hospital. It depends about you. And as I said, it's maximum 4 on calls per month. But if you want to go for a private sector also, you can choose your life. You can choose either just to do a morning duty. You want to have on calls. You don't want to have on calls. You want a female to call you at time of delivery, either at 2 a.m., 3 a.m. You are getting money. You are getting more money. So you want this lifestyle. Sometimes you can say, no, I just want my OPDs. I can deliver you in the morning. I can do cesarean in the morning, but at night, no one call me. So you choose your lifestyle because you are the one who control your life. You are the one controlling your income. It's all about income. As much as you work more, you have more income. If they call you at night, for sure they will pay you. But if you said, no, no one called me at night, khalas. Once you are starting your OPD, your patient know that if they are delivering at night, they will not call you. The hospital know that they will not call you. So you are free at night. So this is the lifestyle. Not as a, yani, not everybody told you, no, you are an obstetrician consultant, they will call you at 2 a.m. Yes, of course, they will call you at 2 a.m., but they will pay me at 2 a.m. If they will not pay me, I will not come at 2 a.m. And also in the governmental hospital, if I'm not on call, no one call you. You are at your home. You will come at your morning duty. So this is basically the lifestyle of obstetric and gynecology. So what are the tips you have to know? To be accepted in obstetric and gynecology, you have to work on your CV as a student. Most of you, I think they are a student or intern. Do a research, join a camping for an obstetric and gynecology, take an elective in the hospital for 1 or 2 months. It's okay. So they know you and they let you work and you can see. And after that, if you want to apply for board certified, for board for obstetric and gynecology, they will accept you. They know you. Try the specialty as a resident. Everyone asks me about obstetric and gynecology. I told them, you are a student, you are an intern. Attach yourself to a resident in a center you want to apply in, and live the life he is living. Like in the on-calls, everything. See, can you handle this or not? Can you take this life or you cannot? This pressure or not? Because if you don't try the residency life as real before you enter the residency program, maybe you get surprised after that with all things came in your residency. Especially if you are accepted in a place that it's not the same as you wish or you think. Like I was in governmental hospital in Mecca. It's too busy center. Like we are doing, our on calls was 16 hours. In on calls, sometimes we are doing 10, 11, 12 cesarean section. When I took rotation at university, in 2 months, I have done only 1 cesarean. So on calls there, I have do nothing. So this big difference between 2 centers, like center you are doing too much and center you are doing almost nothing. You are looking for this life or this life, or this center or this center. Can you handle this center if you go on, or you cannot? Some of the resident, when they applied in like private hospital or in universal hospital, and they took rotation in the governmental hospital, they couldn't adjust with the center. They found it's too heavy and too much. Yes, there is some resident, they are seeking psychiatry. There is some resident who cry every day. It's tough, but at the end, if you love the specialty, you can deal with it. As I told you before, that we are mainly the higher specialty with the medical legal issue, but don't let this medical legal issue get you afraid. As I told you, if you go systematic and you ask your senior about everything, you can deal with all these medical legal issue and you don't have any problem with it. Male doctor. As I told you, it's only a female patient. So what about us? What about the male doctor? Can I go smoothly in obstetric and gynecology? In the past, the female was about, they don't allow the male doctor to work or to see them or to examine them or talk to them. But nowadays, the female patient start to look for a male doctor. They don't want a female doctor. There is some reasons. So there is some different reason between this and this. But as a male doctor, yes, you can work, you can examine the patient. Sometimes it depends also about the center and the culture of the hospital that you are in, like in Force Armed Hospital or like in Secretary Hospital. Yes, there is, because culturally, the female and the family, they don't like their female to be exposed to a male doctor. So keep this in your mind. It also make a difference. What are the culture that you are working on, where you are work, because all of these make a difference for you as a male doctor, not as a female doctor. As a female, you are dealing with it, but as I told you, you have to handle the hormones disturbance for the female. If she shout on you, she punish you sometimes at the time of delivery, it's okay, that can happen. So this is basically the obstetric and gynecology in brief. I want to talk more, but I want to know from you what you want to know more about the obstetric and gynecology. I want to listen from you, listen what you have an idea and what you want to know about that. And at the end also, you can contact me. Everyone is free and welcome to contact me at any time and ask me whatever you want. So the door is open for anyone who wants to ask anything. Teresina?
Yes, doctor.
Yes. Is there any question or anyone want to ask about anything, or if you have any comment? Okay, Muhammad. Muhammad want to ask. Can we give him the mic? Teresina?
Yes, doctor. I allowed the mic from Muhammad.
Muhammad? Oh, okay, he's not here. طيب, Maria Al-Rafai, I think want to ask a question.
Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Hisham, how are you?
Alaikum assalam, alhamdulillah. How are you, Maria?
Yeah. Alhamdulillah. This is Maria Rafi. First of all, I'd like to take a moment to thank you for your time. This has been a wonderful, informative session. And thank you so much to Dalia and Zaina for their efforts moderating as well. So I would like to ask, in regards to the fellowship options in the Kingdom of Saudi Arabia, and how competitive these are, especially IVF and reproductive medicine. Do you have any knowledge on that?
Yeah, unfortunately, the easiest fellowship that you can have in Saudi Arabia is the fetal-maternal medicine. There is about 10 positions in Riyadh every year, and about 1 position or 2 positions, I think, in Jeddah. So this is the much positions we have in a subspecialty in Saudi Arabia. About the gynae oncology, we have only 2 positions every year, one in Riyadh, one in Dammam. So it's highly competitive. And the problem is, yani, you have to know someone to accept you. No one is accepting by CV and what he did. No. About the infertility, unfortunately, we have 4 positions every year in Riyadh. And again, they are taking the one who they know and the one who worked with them before. So, yani, the point of CVs and researches and that, it's taking a few point on accepting. In Jeddah, we have an infertility IVF fellowship, 2 positions every 2 years. So year yes, year no, year yes, year no. Jeddah, we have 2 positions, highly competitive. Like have been accepted last year. We were 40 just applying for 2 positions. Jeddah, you have some chance to provide your CV, to provide yourself in the interview so they can accept you, but not as Riyadh. Eurogyne also 2 positions in Riyadh, and I think they open 1 position this year in Jeddah. There is a big challenge. Unfortunately, there is no available seats for all the candidates apply. As I told you, yani, for 2 seats we applied 40. Like in MFM for 12 seats, the apply is 60 or 70%. So it's highly competitive. But inshallah, we are yani, hoping to open more centers for the fellowship.
Thank you so much for your mashallah, extensive reply. It shows that you have a lot of experience with this. So I'm very happy that I've taken the time to actually attend your session. Allahumma barak. If you don't mind, can I expand the question a bit and ask, if you have time, going abroad, for example, going to do a fellowship in the UK when it comes to IVF and reproductive medicine, would that be useful if I were to go abroad and then come back?
Yeah, you can go. You can, a lot of the doctors are going abroad and they come back. But let's speak where you want to go. Like in infertility,
the UK, inshallah, England.
Okay, UK, you have to find what they have. What are their recommendation at what they want, exams or scores for English or like that. But you have to keep in mind that is their program a curriculum or a professor based? What's the difference? The difference is if you have a curriculum, so curriculum program, there is a curriculum they are following. You will finish the fellowship after you finish this curriculum. Like in Europe, in France and Germany and I think Finland, they have infertility, but it's a professor-based fellowship. So what does that mean? You are attached to a professor for whole the period, 1 year or 2 years. Then he is the one who providing you the certificate that you are fellowship. Okay, it's from the committee from their country, but at the end you are just only learn from that professor. What he is doing, he is learning you. What he don't do, he will not let you to learn it. And what he want to learn, you, he will give it to you. And if he don't want to learn you, you will not get the benefit from him. So this is the problem. So most of the candidates ask for infertility from Canada because Canada is one of the biggest countries in the infertility, and they have many positions. They don't ask for exams, and they have a curriculum. Once you finish this curriculum, you get the certificate for the fellowship. UK, yes, it's good, and you can apply for that, but ask about the curriculum and about the professor-based. Anyone have other question? Professor-based fellowship is limited? No, you cannot say it's limited unless in Europe they don't have curriculum. As I told you, in France it's only professor-based. In Germany it's a professor-based. I mean for the fellowship. Countries you recommend for OB specialty? For OB specialty, Saudi. Don't go outside for OB. And if you want the Saudi the board for obstetric and gynecology, do it in Saudi Arabia. They are accepting about almost 50 or 60 person per year or more. Like in Mecca, they are accepting 20 per year. Jeddah almost 25 or more than that. So this is only Mecca and Jeddah. So what about Riyadh? What about that? You don't have to go outside unless you have a scholarship for board and fellowship. You have in your mind a fellowship that you want to continue and you got the scholarship, go ahead, do obstetric outside if you can go for that. Yes, it's good. What SMLE grade is guarantee for ensuring? Wallahi, unfortunately SMLE grade هذه بدأت تصعب على أيامي قبل 10 سنين تقريبا يعني 70 كانت تدخلك OB بالراحة. Nowadays ما شاء الله أنا شايف I'm seeing the scores is too much highs and I don't know. Last year I think in Mecca the least degree was 80. I think they are accepting. So it depends about the batch you are with. If the batch is having high degrees, so you will be. The problem is what? The problem there is subspecialties that is competitive, like ophthalmology, ENT, dermatology, plastic surgery. These competitive specialty, and they have list seated for residency. But like in obstetric medicine, general surgery, pediatric, they are accepting much. They are accepting more resident. So again, it depends about your degrees in the acceptance. SMLE alone, it's not a candidate. Like you said, if you have the CV points nowadays in من الهيئة, you have to fill your CV, because the CV point, it's more than the SMLE. I think SMLE, it's only 20% from all the total score. It's your GPA, your SMLE, your CV, but the CV point is more than the SMLE. Right. Doctor, do you recommend Security Force Hospital or MH Hospital to take the residency program? طيب يا داليا. داليا, as I told you, Security Force ولا MOH يعتمد how much you can handle, because يعني ال pressure في ال MOH it's too much, فعليا too much. في ناس ما قدروا يكملوا فيه. طيب بينما السكيورتي فورس هوسبيتال اللود اقل. بس نيجي منظور ثاني، الناس اللي بتشتغل في الام او اتش اللي بيطلع قوي بيطلع من اقوى الاقوياء، because he is dealing with a patients you will never see it anywhere. يعني والله امانه honestly there is some cases which is written rare in the box guideline. You are seeing in MOH بطريقة خيالية. You are seeing this patient frequently. You are dealing with every single complication that can be seen in obstetric and gynecology, which is you cannot see it in security hospital. Like comparison here in Makkah between MOH, MCH hospital and Security Force Hospital. Security Force Hospital, they have only 3 delivery rooms. In MOH, they have 10 delivery rooms. The capacity of the bed for the MOH, they are having almost 120, 150 bed. In Security Force Hospital, you're only having 20 bed. So it's a big difference. But in Security Force Hospital, you have much more time to read, to learn, to attend conferences that you don't have it in MOH. But at the end, in MOH, you are working, you are getting stronger. So you are the one who choose either Security Force Hospital or MOH. You have to have rotation here and rotation here, and then you can ask for that. Right. How competitive is it in Canada or the US? US, they want the USMLE. So I don't know how many seats they are giving internationally, because each country they have international seats and local seats. So you have to look at the embassy or الملحقية طيب to see, because there is some countries there is a contract between our government and them, like in Ireland, France, Germany, Italy, I think, Europe in general. We have seats. We have Saudi seats, not an international seat, not a local seat. It's a Saudi seat. So you can apply for these seats, and you know how many seats they have. SMLE is 50, CV 15, 34. So okay, SMLE is 55. It's too much now. Right. as a male doctor, are any cultural barriers nowadays or challenges? I told you, as a male doctor, depend about the culture. Yani, you can face someone you don't expect from him to accept you as a male, but he accepts you, and the vice versa. One of the time, one patient, he bring me a police in the hospital because I talked to his wife. Yes, he bring me the police. Unfortunately, he was a professor coming from Canada, and he's saying no one in Canada male allowed to talk to my female, to my wife. So معلش يعني you cannot expect from anyone to accept you or not, but at the end they have their right. طيب. But if you are working on a governmental hospital and you are the only doctor available in the hospital, you have to tell the female, to tell the patient that I'm the only doctor available in the hospital. Either to accept or you refuse. If you refuse, you have to sign for the complication that can happen, that I'm not responsible for it. And one of the time I remember that we were in one on call, we were 7 males doctor, from the consultant till the most junior resident. All of us were a male doctor. So from the ER, we were telling the patient that tonight we don't have a female doctor. So we will not call for a female doctor to come for you. Do you accept a male doctor to examine you, talk to you, deliver you, or you don't? If you don't, you can go. You can leave. It's a schedule. The doctor's available. Either you want to be seen by a male or not. If there is a female doctor, her right that she can refuse you and say, no, I need a female doctor to examine me. As I told you, nowadays I see more patient who is looking for male doctor. They don't want a female doctor. So again, it depends. Like in a Taif, you can expect to find someone who accepts you or not. Jeddah, they are accepting male much more. Riyadh also, they are accepting male. So nowadays they are accepting male in the field, and they don't. And you will find someone who accepts you, and you will find someone who will not accept you. Like, regarding the specialization in obstetric and gynecology here in Saudi after MBBS, what are the conditions for admission usually during, for example, Saudi Commission for? Well, I cannot answer. What are the score, the save range? As I told you, it's different from year to year. يا ليان you have to find your batch ايش السكور اللي موجودين فيه. بس as I told you, الcompetition ما هو مرة عالي comparing to the subspecialty like of the ENT. So كم exactly ما اقدر احدد لك، لانه يعني our days 50 كان ينقبل التوتال كان ينقبل OBGYN. Nowadays 85 I think they are accepting in OBGYN. So it is different from patch to patch. Is الشماسي consider an MOH? الشماسي I think it's عسكرية. I don't know. Is it MOH or عسكري? I don't know والله. What are the medical legal issue? Medical legal issue depends about how I told you. To dealing with a female, طيب. يعني as a male doctor, never seen a patient alone without a chaperone, without a nurse female, because if the patient said anything about you, she will be يعني حيصدقوها، هتكون مصدقة بالنسبة لهم. So this one of the medical legal issue. The second one, after delivery, baby delivered with a problem, hypoxia. So this is قضية رفعت على طول شكوى it can provide it to المحكمة. If you were wrong and you are dealing wrong with the patient at time of delivery, you will be punished. But if you are not and you are dealing with the protocol and there was nothing wrong with your medical procedure, so no one will blame you. But ليش أقول كده؟ لأنه للأسف complaints الشكاوي القضايا بتترفع بسهولة في التخصص هذا. على طول أي حاجة they are applying for complaint ويلا خذ لك سنة 6 شهور 7 شهور for asking and what has been done, what has been not done. شكلوا لجنة نسوي نحقق. ف this is the medical legal issues that you can find mainly in the time of يعني in the period of delivery and baby. If you have healthy baby, healthy mother, no one will tell you anything. If you don't, if you have one of them is not healthy, for sure they will blame you, but sometimes it's not your problem. Like in governmental hospital, the female is following 9 months, 40 weeks, she's following outside and she came to deliver with you and you don't know whatever she has. She don't tell you she's diabetic, she's hypertensive, she's taking medication. You don't know anything about her, but you have to deliver her. So to keep in mind this, that you are dealing with a community till now, unfortunately, not 100% is aware about how to deal with their pregnancy, and they have to follow where they have to deliver. They have to follow on to tell the doctor everything. Yani, this we need more awareness in our community. Yeah, 80, they say it's good number for Ismaili. Yes, of course. Where can we find you in social media? موجود تويتر، موجود سناب شات. You can call me in WhatsApp في الجروب حق هذا. Call my phone number, I will give you my social media. وأي حاجة تحت أمركم. You can ask me anytime for anything. I'm with you for anything. وأرجع أقول لكم لا تخافوا من الأو بي تخصص. ما أعرف، ممكن في ناس يكونوا اليوم بعد المحاضرة فكروا إنهم لا ما يدخلوا أو بي. الأو بي تخصص جدا جميل، جدا رائع وممتع، بس تعرفوا كيف تتعاملوا فيه. للأمانة سنين الريزيدنسي سنين تف شوية، خصوصا إذا كنت في مستشفى فيها لود عالي. لكن اللود العالي هذا والله إنه إذا أنتوا أو أنت كشخص تبغى تتعلم، تبغى تشتغل على نفسك، حتطلع إنسان جدا كويس. لكن إذا أنت قضيتها إنه أنا بس أعدي البورد، أخذ الشهادة في المستشفى، حالة ما هي مع التيم حقك، تقول والله مو شغلي، ما أروح أتفرج، ما أروح أتعلم، unfortunately لا. You will not learn. You will not be good doctor. You have to attend and to learn from each case. You will never find two cases the same at all. At all, you cannot find a patient with the other one is the same. Totally they are different. يعني two patient healthy, two patient at the same age, two patient زي ما قال الكتاب. But at the end, you will find a different result في two patient هدول. Why? You don't know. You have to learn from each patient. يعني والله I remembered one patient I have done. She was a prime gravida. I have done for her cesarean section. I start at 3 a.m. I finished at 4 p.m. You know, I start 3 a.m. I finished 4 p.m. and she's a straightforward cesarean. But it's you get learn from each case. كان في consultant عندنا الله يذكره بالخير يقول كأوبستاتريك never ever تفكر إنك أنت أخذت كل حاجة وتعلمت كل حاجة وتتكبر على التخصص هذا، لأنه حالة واحدة ترجع تخليك في الصفر. هذا الكونسلتنت كنا نعتبره أسطورة من الأساطير. He has one case which is straightforward, end up with hysterectomy. استأصل فيها الرحم. غلطه هو؟ لا مو غلطه هو. مشكلته هو؟ لا مو مشكلته هو. الريسبونس حق البدي حق البيشنت رفض انه بعد السيزيريان الرحم يوقف نزيف، فاضطر في النهايه انه هو يعمل لها سيزيريان، اضطر انه يعمل لها هيستريكتومي، يشيل لها الرحم. ما هي مشكلته هو، وهو شاطر وهو جراح كويس وهو دكتور ممتاز والحاله ستريت فورورد ما فيها شيء، لكن في النهايه الريسبونس حق البيشنت. فهو لما خرج من هذه الحاله قال لي يعني نيفر ايفر تفكر انك انت تقدر تسوي كل شيء او انه كل الحالات هي نفسها. التخصص جميل، تخصص حلو، لكن ارجع اقول لكم لا تدخلوا التخصص بدون ما تجربوه. لازم 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 تجرب التخصص في المكان اللي انت تبغى تاخذ البورد فيه. جربوا كريزيدنت، لا تجربوا كستودنت او كانترن. والله يوفقكم جميعا، ومرحبا بكم في اي حاجه واي سؤال اي وقت. اعتبروني اخوكم وموجود معاكم ان شاء الله. اي سؤال اي استفسار ثاني؟ طيب, in order for me to a better doctor, how can I prevent this issue? Follow the protocols. Follow the protocol. Follow the steps. لا تفتي من راسك. الشيء اللي ما تعرف قول ما أعرف. أتعلم. كلم السينيور. You will prevent the medical legal issue from happening. يعني التخصص حقنا ما ينفع فيه له إفتاء. يا تعرف يا ما تعرف. تعرف سوي، لكن also إذا أنت الجونيور you have to ask your senior. لا تسوي بدون ما ترجع للسينيور، لأنه الغلطة عندك محسوبة عليك تماما إذا أنت ما سويت الشيء صحيح. تمام؟ ف following the protocol, following the rules, you will be safe from any issue. موفقين إن شاء الله جميعا. طيب, أي استفسار قبل أو سؤال قبل ما نخلص؟ طيب, if you have time, can you briefly mention the pathway to this specialty in Canada as an international medical student? طيب, in Canada والله صراحة ما أعرف، بس اللي بيصير إنه you have to apply في مواقع الجامعات. كندا كل جامعة قبولها الحال، وكل تخصص قبوله الحال. فيو have to look for the university you want. طيب, في مcgill، في تورنتو، في مcgill وتورنتو ميشيغان، في different university. بتدخلوا على اليونيفرسيتي نفسها. طيب, بتلاقوا الابلكيشن متى بيفتح، متى التقديم حق البورد، متى بيبدا التقديم حق الفيلوشيب. تدخلوا تشوفوا ايش المتطلبات اللي هم يبغوها. وطبعا اهم متطلب موجود اللي هو الضمان المالي. الضمان المالي ايش معناته؟ معناته you have to have a sponsor. اذا وزاره التعليم، اذا جامعه، اذا ابتعاث خادم الحرمين الشريفين، اذا وزاره الصحه، عسكري، اللي يكون. هذه اول ورقه تنطلب من اي انترناشونال او اي واحد يقدم على تخصص برا. يطلبوا منه الضمان المالي. الضمان المالي هذا لازم توفره عشان ترفقوا، وخلاص وتقدموا عليهم، تبعتوا لهم ايميل. بعد كده كل التواصل بيكون ايميلز بينكم وبين الجامعه. الجامعه بيكلموكم، بيعملوا معاكم انترفيوز. في بعض الجامعات يطلبوا منكم انكم تروحوا عندهم اسبوعين اتاتشمنت، يشوفوكم، يشوفوا كيف وضعكم، يقيموكم، وبعد كده عادي يردوا عليكم اذا في قبول. والقبولات مو شرط السنه، يعني ممكن هم يرسلوا انت تكلمهم السنه وكده، يقول لك اوكي والله احنا قبلناك على 2030، احنا قبلناك على 2029، تبدا دراستك 2031. فهو مو شرط القبول يكون سنويا زي السعوديه. السعوديه كل سنه بسنتها. هناك لا، انت بتنقبل ممكن يقول لك انا قبلتك على 2030، خلاص 2030 تنقبلوا هناك. like yes, like OSAP application, yes. فزي ما قلت لكم. طيب, my ex user name صراحه ماني قادر اكتبه، الشات مقفل عندي. HESH A capital B capital H capital ESH A capital B capital. وبرضه رقم الواتساب حقي موجود في الجروب اللي سووه حق المحاضرة اليوم. وأي استفسار أي وقت أي أحد بيتواصل معايا تحت أمركم جميعا. يس بالضبط يا زينة. طيب, any other question?
يعطيك العافية دكتور، ما قصرت.
الله يعافيك يا رب. يلا موفقين جميعا إن شاء الله.